Yeah, big thank you. This has been an all-hands-on-deck approach since we learned of this pandemic, and we appreciate the leadership of the state of Connecticut and our local mayor here, our chief elected officials really came together, and the collaboration has been remarkable, all in an effort to protect our community, the health and life safety of the community we all live in and serve. So thank you all. I appreciate it.
Thank you, Karen. Thank you, Matt. Just so you folks know, I'm sure you do, that Matt and Kara and Fernanda Carvalho have been just the champions of this for the city of Danbury. They have worked tirelessly. I get emails from Kara at 2 o'clock in the morning, and she never stops. I don't know how she does it, especially being home with 2 young children. She's just been a fabulous asset to the city of Danbury, and our volunteers and our nurses that are here, and to our teachers that are here. I just want to thank everybody for all that you do every day. And so I'm going to introduce Commissioner Bai.
Thank you, Mayor, Senator Blumenthal, and Governor, and I know Senator Kushner is here, and I know we have a state rep here. Pat, great to see you. Just so happy to be here with Governor Lamont. It's amazing working for Governor Lamont. He pushes us hard, but he also is a learner, and he wants to know what's happening around. And the reason we're in Danbury today, it's not by chance, because Eileen Costello and Kara and the rest of the team here have been doing an incredible job organizing vaccines for child care providers. And I also know your district, Kara, did an amazing job for teachers. This has been a heavy lift, a local effort combined with a state effort, the Department of Public Health, and Governor Michelle Gilman in your office. Danbury is known for its collaboration, Mayor, as you know, and it shows here all the years of the work that you've done across party lines shows, and that's why we're here today, because of the incredible collaboration. Eileen tells me by the end of next week, 3/4 of the child care providers will be able to have access to vaccine. We're doing some work on vaccine hesitancy and any barriers to getting a vaccine, because Governor Lamont said to me, we're going to prioritize child care providers. We got to figure this out so that by the end of March, every child care provider who needs a vaccine will get one. The other piece I want to announce today, and the governor may say more, but Connecticut received $74 million in relief thanks to the efforts of Senator Blumenthal and the rest of our delegation. We're rolling out the first piece today here, Senator and Governor. The governor has approved a plan that Connecticut will pay the parent fees for parents who are on child care subsidy for 6 months. So this can mean, on average, $129 a month for really low-income families, and for families that make more, it's more. But for 6 months, we'll be waiving the parent fee to make child care in camps more accessible. This is an $8 million investment, and I know the governor has more to say, but he told us we need to help parents and we need to help programs. And this really helps programs, because for parents who are really stressed, often the programs say, don't worry about your fee, we'll just take the Care for Kids subsidy. So this is a big deal for programs and our family child care homes, and a big deal for families who are so stressed, and this is particularly focused at families who've suffered the most during this pandemic. We're so grateful for the federal help, Senator. So thank you all for being here. I look forward to hearing from others.
Thank you, Commissioner. And now I'm going to introduce State Representative Pat Callahan, and then followed by Senator Julie Kushner. Pat?
Good afternoon, everyone. I had to defer to Senator Kushner, ladies first, and she certainly outranks me. I'm a newly elected rep from the 108th District, which is part of Danbury, and deep roots in Danbury. As I mentioned inside, I was a football coach here, a bartender, and graduated from Western Connecticut State University. Being here at Rogers Park is perfect because my wife is a teacher, and I know what you teachers have been through. And trying to teach the kids who are at home on the screen and pay attention to the kids in front of you who, let's face it, it's been such an impact on them. They need the socialization. They need to be together. And so Connecticut doing such a great job getting everybody vaccinated is going to take care of another part of this, is getting everybody back together, getting the sports on the field, and looking after the mental wellness of the kids. So thank you for all the help that we've had. Connecticut's done such a great job getting the vaccinations out. Let's hope life gets back to normal very soon. And thank you, teachers, and thank you, healthcare workers. Appreciate it.
I'm Julie Kushner. I'm the state senator for Danbury, New Fairfield, Sherman, and part of Bethel. But really what's so exciting today is to be here on a day where we're hearing the announcement about the investment in our child care programs. You know, I've always thought that Governor Lamont was a smart guy. I knew that a long time ago. But when he appointed Beth Bai as the Commissioner of Early Childhood Education, I knew he was even smarter than I thought, because she gets it. She understands this world of early childhood education. And that's what's so important. Getting our care providers vaccinated today and as a priority is so incredibly important, but also investing in the families and providing subsidies and paying 6 months of childcare. I know what that was. I remember when I was paying for childcare with my 3 kids, getting 6 months of my fees waived would be immensely important. So I want to thank the governor. I want to thank Beth Bai for her attention to this important aspect of the program. And I especially want to thank our Senator Blumenthal for fighting for us in Washington, D.C. And this recent package is amazing. And we know that you were there on the front lines making it happen. So thank you so much to everyone here. It's great for working families.
Okay, next up to the podium needs no introduction. The gentleman needs no introduction. Senator Blumenthal.
Well, thank you, Mayor. Thanks for bringing us together. I think at almost exactly this moment or around this time, President Biden is doing a ceremonial signing of the American Rescue Plan. He signed it formally yesterday. He's doing a ceremonial signing, probably outdoors at the White House, but quite honestly, I'd rather be here. I'd rather be here on the ground in Connecticut, where we are making the American Rescue Plan work, and we are recovering and leading the country, thanks to the kind of leadership you have right here, beginning with Governor Lamont. Makes me very proud to be a resident of Connecticut and to represent Connecticut in the United States. But we also have great state leadership, Representative Callahan and Senator Kushner, and Senator Kushner has been a longtime friend and an organizer over many years, and if I needed no other impetus, she would be it. But let me just say, you know, I've been all around the state of Connecticut over the last year, and I heard again and again and again in these recent months, we need more vaccine, we need more child care, we need aid for local businesses and governments and for our state government. The American Rescue Plan is revolutionary. Not only because it puts more money in people's pockets, it puts more shots in people's arms, it puts kids back to school safely, but it recognizes the importance of children. The American Rescue Plan puts children first. The child tax credit is going to lift half the kids in poverty now out of poverty. And the aid that is coming for child care means not only that people will be able to go back to work because their parents have the assurance that their kids will be cared for, but it also means that their learning will be enhanced. And I think that Connecticut is extraordinarily well served by our commissioner, Beth Bai, also a former colleague. But what Connecticut gets is the importance of children. And Connecticut will receive big dollars for child care. In fact, the total amount that Connecticut will receive is about $277 million. $277 million, $170 million of it going to the child care providers. And here, very importantly, about $100 million or more going to the families so they can afford child care. So it's not only the providers, it's the families that need it who will be helped by the $277 million in federal funds. This money is an investment in our future. It's not spending. It is an investment in our future. And the folks who work in this school, thank you to the great educators who are here, and who do the child care providing in the 2,000 facilities and sites that we have around the state of Connecticut are really among the heroes of this time. This American Rescue Plan will enable children to get out of poverty in a way that we haven't done before in this country. And we know that if the providers get more vaccine, they will be safer, but families will be safer. And I'll just finish on this note. There's also a racial justice element here. A lot of those teachers and child care providers are people of color. And the governor, very rightly, has made it a priority to do outreach. This vaccine program is going to enable more outreach. It will enable more people in communities of color to have the vaccine. It will enable more people and children in communities of color to get out of poverty and to have a safe place to go. And so I'm very proud of this $1.9 trillion program. I'm glad the president's signing it, and we need to do more. We cannot stop, we cannot rest on what's being done now for childcare. There needs to be more, and I know with this kind of team, Connecticut's going to continue to lead the way. So thanks for having me today. Thank you particularly to the teachers and the nurses and our police and firefighters who have really been on the front lines for this year. It's been a long year. We see light at the end of the tunnel. Nobody knows exactly how long the tunnel is, but the president's hope and light that we're going to reach that end is due largely to the kind of commitment that you see in Danbury and in other cities and towns around the state of Connecticut where people come together. They come together to solve problems, and they are a model for what we need to do in Washington. Thank you.
Senator, thank you very much for those words. I would be remiss at this point if I didn't, before I introduce the governor, just do a shout out and a thank you to former Mayor Mark Boughton for the work that he did up until December of this year before the governor stole him out of Danbury. But it would be good to just give Mark Boughton a round of applause for all his hard work and his efforts. So, thank you. And so now I'd like to introduce the gentleman who's responsible for me being the mayor of the city of Danbury, single-handedly, Governor Lamont. Governor.
Yeah, Joe, well, thank you for lending us Mark Boughton. And Joe Biden, we've lent you Miguel Cardona, not forever, but he did an extraordinary job here as our Commissioner of Education. How many of you have been vaccinated? How many of the teachers have been vaccinated? I'll tell you, I mean, Julie and I just got our second shot today, and I was asking the nurse, what's it like? Are people coming in anxious? They coming in happy? And the word was, whatever they came in, they walked out liberated. It is liberating. And this sunshine is liberating, and it's a new day. And, you know, I was here in August, and remember, we were getting hit hard here in Danbury. We're having a hard time keep getting our schools open. And we're going to take advantage of what this means. This vaccination, with the mask, we've been playing really good defense. With the vaccine, we're playing offense now. Your schools are open. These kids are coming back. I understand you just told me about maybe half your kids are back in the classroom now. We're going to give them a call. We're going to do everything we can to encourage them to come back. And we're so thankful to our teachers for stepping up and being here on behalf of those kids. That's why you're prioritized when it comes to getting the vaccine. And all the folks here at the school, work in the school, you know, food service and custodians making a difference there. And Beth Bai, you know, said, when we're talking about educators, just remember we're also talking about child care workers who have been stepping up every day since the start of this pandemic. So I'm told that we vaccinated about 1,000 teachers yesterday. We have 100 plus you know, child care workers here getting this state moving again. And I want to give you a challenge. You know, Senator Blumenthal mentioned that the American Rescue Plan here is here, and it's not spending, it's an investment. But we need each and every one of you and your very best ideas to make sure this is money that makes a difference. I mean, I'll start off with the teachers. I mean, we've got a fair amount of money, thanks to Senator Blumenthal and what's going on in Washington. And our job is to make sure this money goes to work. Our job is to make sure that these kids who haven't been in the classroom for 7, 8, 9 months, a lot of them feeling isolated, a lot of them social distress, a lot of them maybe not ready to learn. This is our job right now, is to make sure that we make the investments we need to get these kids back in the game. This is not a lost year. We're going to make sure that they step up in terms of what happened in the last year and hit the ground running in September. And we don't wait till September. We're going to start up in July, right? We're going to start up with some programs, and I need your help, you know, working with our new Commissioner of Education, Charlene, in terms of what are the best ways that this money can be put to work. So as Dick said, it's an investment. And nobody understands that better than Beth Bai, what it means for child care. You know, there's hundreds of millions of dollars for child care, and we're going to subsidize, we're going to make it very low cost. But to me, it's doubly important, because education starts with child care. And if we get this right, this is not 2 or 3 year money. You know, Dick Blumenthal, I'd like to think this is a commitment. Maybe the federal government's going to appreciate what a difference this can make over a long period of time. And a personal interest or passion or concern I have is that we have fewer women in the workforce today than any time in the last 30 years. And a lot of that's because of this pandemic and the nature of the jobs that were lost and the cost of child care and the such. I'm doing everything I can to make sure we can get our folks back working. Child care, schools being open are a big piece of what that is. So my challenge to each and every one of you is we have an extraordinary opportunity to make a difference with the resources the federal government is providing us. Let's make a difference on behalf of those kids, those children, those babies, because that's what we're in this together for. So Joe, thank you for inviting me back to Danbury.
Okay, so that concludes this portion of the press conference. Governor, did you want to do a question and answer, or were you prepared to do that? Or? Sure. No? Okay, so we'll open it up for a question and answer session with the governor.
Governor Lamont, yesterday President Biden was talking about the May 1st date in terms of having vaccines available to Americans. Also, the administration is talking about things like veterinarians and dentists getting involved with vaccinating. Can you talk to us from the Connecticut angle about what the president said and how feasible you think those things are here in our state?
Yeah, I'll start, and then Dick, you can step in. The president challenged us. He said, look, I want to make sure that everybody has the option of getting a vaccine May 1st. In terms of prioritization, open the door. And that's pretty much what our schedule has been. Obviously, the only limitation we have is the number of vaccines we have that are coming, as Dick mentioned. Right now, we had planned May 3rd. We're going to be able to accelerate that. We're getting more people vaccinated faster and more vaccines coming from Washington, D.C. than we had anticipated. So I appreciate the president's challenge May 1. We're going to beat it.
Governor, when you say accelerate, are you just talking about that age group moving from the 3rd to the 1st, or will all the age groups push back a little bit?
Give us another few days, John, to get back to you. But I think we're going to try and accelerate along the way, not just the May 3rd age group, the May 1st, but beyond. It's a function. Look, how fast how much you open the lens is not a question of how much we love you. It's a question of how many vaccines we have to distribute. And we're getting more vaccines. And John, the other question is, what % of the people are going to want to get vaccinated? Is it 60% or 80%? But we're going to have a much better idea on that over the next week. People 55 and above are getting vaccinated very quickly right now. That's the usual cohort.
Let me
Sorry, you're all
just,
too young for that.
Let me just add, because partly Connecticut has really inspired this accelerated schedule. We started with a goal of 1 million a day, reaching 100 million in the first 100 days. The United States is going to beat that goal. What Connecticut has shown is if you have the vaccine, people will come. Provide the vaccine, people will use it. This idea of hesitancy, I think, has gone by the board. Education has convinced everyone that it is important to do. And one of the most important things about this American Rescue Plan, it puts vaccine manufacture on turbocharge. Vaccines are going to be available to everyone who wants it by May, period. End of story. Everybody who wants to be vaccinated will have it by May. Connecticut has led in the delivery. Connecticut has said, give us more vaccine, and we'll deliver it. And that has inspired the kind of major commitment to manufacturing that you're seeing in the American Rescue Plan. Literally $20 billion going to not only manufacture, but also delivery. I came this morning from a clinic down in Stamford. Uninsured people can get it for free now. If you're uninsured, if you can't pay, if you're worried about the fee, get the vaccine because it will be available by May. So all this schedule stuff is going to be a memory in May.
Governor, can you or Commissioner Bai expand on what we're talking about with the waiver?
Sure.
It's
Yeah.
the fee, not the entire.
Right, right. No, I can explain. So in Connecticut, for people, families that make, a family of 4 that makes less than $60,000 a year is eligible for child care subsidy. But based on their income, they also have a parent portion between 2 and 10% of their income. So we are waiving that fee for families. So families will not pay that fee, their share, if you will. The state is picking up the parent share of the child care subsidy for 6 months. So it's about an $8 million investment. So that's how that works. Does that answer your question?
Yeah, this is all from this current tranche or?
This is from the $74 million. As the governor said, he has challenged us to go big and think about the much larger package coming our way. How can we help more families? How can we help child care programs, as Senator Blumenthal mentioned, is intended with those dollars.
So that's from the previous one?
That's from the $74 million, and in a couple weeks we'll be rolling out the grant program. There's $47 million that the governor's reserved for child care centers and family child care homes. That grant program will be announced at the end of March, and that's from the second tranche of $74 million. We spent 97% of the CARES Act, which was the first. So the second was approved last week by the feds, approved by the governor the week before. So this $8 million is the first announcement of that $74 million.
So does that just help them stay in business? Because a lot of them have been struggling.
Yeah, the idea is I think the way that the Senate and House structured it was that we would be sending operational dollars to programs. Half of the programs in Connecticut, either their directors or the family child care homes, have been putting expenses on their personal credit cards to stay open. These folks are so committed to the families that they work for. So getting a grant will help them pay back those expenses that they've incurred and also help with things like maybe they're behind on the rent or the mortgage because of these challenges. They've had much lower enrollment. So yes, those funds will be used as grants to help with operating expenses.
And I might just add on that very, very importantly, this money can be used to start new child care centers. In other words, we've lost, I don't know how many, Beth, we've lost. Many have closed. When I went around over these past months, I've seen child care centers that told me they were closing. So these grants, very importantly, can be used to replenish the number of providers that we have, especially if they've been forced to close.
Is enrollment back up? I know that you had said
Yeah.
it's gone down dramatically.
Yeah, most places are reporting that they're down between 10 and 20%, and that's at least, but it's the worst in our priority districts. And so the grants will be structured in a way that recognize the communities like Danbury that have struggled the most with enrollment.
But is that because people are just not going back to work?
It's a combination. Some people have lost their jobs. It's very hard if you don't have a car and you have a child and their public school's closed and you've got to get another one to child care and you're already home anyway because the other child's home. So even if you have a car, it's hard. So families have been making different choices about child care that have put tremendous strains on them. But right now we're at about 70% of our pre-COVID capacity for child care. So we want to get back up to 100%, as the governor said. And he's just said to us, get the people back to work, make them, make the market work, help families, help the market to work for child care.
How many daycare folks are getting vaccinated today?
I think I heard 100 today here. And then Eileen said that by the end of this week, about 75% of those who asked for an appointment will have a vaccine by the end of the week. And then we're going through the end of March. And just to give you a sense, every child care provider in Connecticut received a text from United Way reminding them to make sure we get the uptake. And every provider had an email with a link to make an appointment as well this week, because especially the family child care providers can be somewhat isolated. So just to try to reach, we're trying to reach 2,000 centers, but another 2,000 small family child care homes who may not be as connected. So we're trying to do everything we can to get them vaccinated.
I know you've heard that a lot of daycare workers say, hey, this process is a lot easier for the teachers, the districts are reaching out to them, it's kind of confusing for us.
Yep.
Can you just kind of go
Sure.
through what you guys are doing to try to
Yeah.
reach out to them?
Absolutely. The reason we're in Danbury is because the community said, everyone is on the same plane. Our health department's going to vaccinate family child care providers, teachers, child care centers. That was the hope, but not all communities had that capacity. Where they didn't have that capacity, each community has an individual plan. Like, for example, Yukon Health Center is doing Farmington Valley Health District because they didn't have capacity. So Yukon sent an email to all the providers. They received all the information from the Governor's Unified Command Team. For every provider received an email. For those, again, that we haven't heard from yet, starting Monday, our licensors are getting out of the field and just making calls to providers to get them out. So we think it's good for everyone if we can help get providers out. Sometimes the hours weren't convenient, so we've worked out a statewide place where any child care provider can go at convenient hours, working with CHC in Middletown. So it is more confusing for child care providers in communities where the health district did not arrange all of it. But everyone has a place, and everyone's received a text, an email, and starting next week, they'll receive personal phone calls. Doing our best to get everything.
Thanks, everybody. Thank you.
Thank you for all you do.